Hi, I'm Dr. Gerald Deas. Welcome to the Health Center from Downstate Medical Center. You know, taking care of people is not only a devotion, it's a commitment. And often people associate just nurses and doctors with health care. But, you know, when you think about taking care of a person, it's more than just medical care. It's a whole host of things. Even the social worker comes into play. How to take a patient at home, how to diagnose, and who sees a patient first. How can you get through all of this myriad of things that you have to go through to see a doctor? Often you see most people are sitting today in emergency rooms to see a doctor. They don't even know the doctor. And what could be worse than that, to meet somebody strange and to take off your clothes? I always tell the students, I said, the only person that you'll find will take off their clothes in 5 minutes when they meet you is a doctor, or somebody who represents medicine as such. Well, they only train a certain number of doctors in this country. For what reason, I don't know. They need doctors upon doctors. And of course, we have our other folks who can take the place of those doctors because they're trained almost as well, believe it or not, as a physician or even a nurse as such. And in fact, it's a combination. They have both because they have a lot of hands-on. And they have come to the conclusion, and this is years ago, that maybe patients don't have to see the MD right away. They need somebody to be screened through to see what their condition looks like, is it serious and things like that. And so they have what they call the PA, physician's assistant. Now, anybody that goes to become a physician's assistant, most of the time, they're not interested in becoming an MD. It's not just a step from our physician's assistant to an MD. They really are interested in that form of medicine because it's a very crucial medicine, a very personal medicine, that they meet the doctor for the first time. And these PAs, let me tell you something, they play a role that you can't believe, from surgery or in surgery, orthopedics, pediatrics, medicine. They take the same courses that the physician takes, and it's very rigorous. It's not an easy task at all, and because you have to be licensed and everything like that also. So here at Downstate Medical Center, we have a wonderful physician's assistant program that trains these young folks in this particular field. And we have one today that I'm going to introduce you to, is Julie Black-Pierce. Great. All right.
Julie Black-Pierce. Good morning, Dr. Deas.
Right. All right. Well, anyhow, you are here with us, and it's good to have you.
Thank you.
I'm glad that you decided to come and join us this morning to give a little background of where you're at in this particular program, physician's assistant. When did you decide to become a physician's assistant? I know you've had a long history of different things that you have done. Maybe just a brief point of show folks out there that you can be in other fields and all of a sudden come into the field that you think you can best serve.
Well, sure. Actually, I started out, I had a degree in mass communications from St. John's University, which of course has nothing to do with medicine. But I had the pleasure of having a mentor, a physician who I ended up working with, and who encouraged me to look into the medical field. Okay. So in 1998, I was accepted to the physician assistant program right here at S.U.N.Y. Downstate, right, because he had 2 physician assistants working with him that were graduates of this program. And they were very, very helpful. They allowed me to shadow them. And I really took the time to learn what the field was about. Okay. And that really encouraged me, because working at a doctor's office, as I was for this particular doctor, Dr. Jean-Claude Compas, I had an opportunity to really get to work with patients. Right. Oftentimes, they were asking me questions that I just did not have the answers for, and I wanted to do more for them. Surely. So this was an encouragement for me to really look into doing something where I could be more hands-on with the patients and helping them with their situation. And the physician assistant program here was an excellent fit for me. I considered myself a slightly older learner. Right. I was in my 30s, late 30s when I came here, and it was a wonderful transition for me. The program here is 2 years and 3 months, and it's let's see, it's a dedication. You can't work, of course, because it's an intense program.
I know that.
But it worked well for me as somebody who wanted to learn to do what I felt I loved and wanted to do in a relatively short period of time and get the information that I needed to do it well.
Well, you know, when you say you went in a different route coming into it, maybe just a little background on that route that you took. You know, you've been an entertainment representative and all these kind of things. Yeah.
Well, you know, as I said, my first degree was in mass communications, and it was because I had a summer job at a nursing home that kind of pushed me into the direction of medicine. I started out working as a ward clerk at a nursing home here in Brooklyn, where this particular doctor, Dr. Compass, was the attending physician on my floor.
Oh, I see.
And there were a couple of other doctors who I used to assist with various things with the residents at the nursing home, and that's where I got my first taste. Even just working with podiatrists there showed me that the field of medicine was very broad.
Right.
As you well know, and you've mentioned, PAs work in many, many different fields, from surgery to obstetrics and gynecology. The PA was meant to really be a team member for a physician. That's what they call that physician assistant, physician team. And we work along with a doctor who oversees us. And then sometimes we have a lot of autonomy. And when you really know your stuff, you may work with a doctor who gives you a lot of latitude in terms of what you do. So I was working in primary care after I graduated from the program here for about 6 years, and now I currently work for a specialist in New Jersey in asthma, allergy, and immunology.
Oh, that's beautiful.
And this is a wonderful thing about the profession, because we are trained across the medical model in internal medicine, pediatrics, we learn dermatology. We can move from one career to other, or we can maybe do part-time in the emergency room and have a regular full-time job in primary care or at another hospital setting.
Well, you know, it's really interesting because even in pediatrics today, you'd be surprised how few people are just interested in coming to medical school and becoming a pediatrician. And when you think about it, because they want to have subspecialties, but we still need the pediatric person, and that's where that PA can do the same thing as a physician in a sense, if it's well baby care and things like that, as such.
Well, you know, that's the beauty of it, and it's unfortunate that a lot of people are not as aware of our field, what we do, as they probably could. Now, a lot of people have heard about nurse practitioners, and a lot of people, unfortunately, will still call us doctors. We always introduce ourselves as physician assistants. And the thing about it that really drew me is not just the short amount of time that it took me to get to where I am today. Because of course, you know, we have to be registered and certified with the state. We are licensed professionals. But that it doesn't matter that I don't have an MD behind my name. The respect is always there, and that's where that team comes. But as a physician assistant, I do everything for the patient that the doctor would do. And I get the same gratification for helping a patient with whatever they need, being a physician assistant. Well, that's good for me.
Of course, I had a PA, a physician's assistant, who was affiliated themselves with not a pediatrist, but an orthopedist. And they could set fractures and as well as the doctor, orthopedist.
Someone's very knowledgeable, just as knowledgeable as a medical doctor.
And when you look at what the cost of medicine is today, and they talk about health care today, the big thing, the meeting in Washington today on health care, they better start looking at their physician assistant program more seriously rather than saying more money into medicine. They need people who will practice the kind of medicine that people need rather than all of these specialties that require big hospitals and more machineries and all that kind of stuff. A lot of money goes to waste in those kind of things, you know, and these special testing and things like that.
You know, it's funny that you should mention that. I can put a little extra spin on that. Cost effectiveness of having a physician assistant working for you. Of course, medical doctors make wonderful salaries, and so do physician assistants. One medical doctor in the state of New York can have up to 2 physician assistants underneath of their guidance. And in terms of cost effectiveness, you could typically have maybe 1 doctor and 2 PAs at a more cost-effective price than having a doctor and then hiring another physician. So it works well. PAs are involved in lobbying in Washington, D.C. for healthcare and policy. We are involved in academia, as I am. I also am a physician assistant professor here at S.U.N.Y. Downstate, as well as the senior clinical coordinator here. You will find PAs working in the military, working for the CIA, working in all types of different areas. And we were born of the medic that's out in the field in the armed services. That's where the career path came from.
Right, sure.
And when these medics came away from the field, they needed something to do.
Of course.
And the first program was at Duke University.
Right.
So after many years of developing that program, it's just grown and grown and grown. If you look at the list from U.S. News and World Report, every year they put out a report of the fastest growing careers. Physician assistant has consistently been near the top.
Well, you know, when I was in the Army during the Korean conflict, I was drafted then, we call almost a physician a medic, you know, and of course when you're on the battlefield, a medic takes care of 9 soldiers. That is, they sit in the center of a firing line so he can watch anybody that gets hit to get to them immediately. And they take the same kind of training at Fort Sam, Houston, Texas, as a physician's assistant before they go into battle and things like that. And I can tell you, if they waited for MDs to do that job, they would certainly not had enough. And certainly, you needed somebody with hands-on, you know. And so, when you talk about being a physician's assistant, you're a hands-on type of physician. Because I even know the chairman of your department, who's a wonderful chairman of your department.
Yes.
That she has shown to really be selective in who she brings into the department, you know, to make it a good department.
Yes, and we're lucky. Dr. Dawn Morton-Reyes, who is the Dean of the College of Health-Related Professions, is also a physician assistant.
That's right.
And she was the chairperson of the department when I came on as a student. So I really look up to her as somebody who has really taken a big leap in the development of the PA program here.
Right. Well, I tell you, I think that if you look at the physician's assistant position today, I think they should hire a number to be in a community, not so much in a center, only a health center, but be located where they can be called to get into that home, because a physician's assistant will make that house call too.
Oh yes,
you know, that's so important.
Yeah, rural areas, you know, well-populated cities, and that's really what we were made for, to work with the underserved, work with the population of people who can't get to health care as they should, and you know, we just really cover the gamut. You know,
I know, really.
The program here has a mission of working in our, what we call our catchment area, of course, you know, which is the area in our neighborhood that, you know, that really covers people that are in need. You know, we're associated, as you know, with University Hospital. Kings County Hospital is right across the street. And it makes our program a very unique program because we are one of the few programs that's actually part of a medical school.
And that's wonderful,
A lot of our instructors are fellows, attendings from the University Hospital Medical School, and that's an advantage that we have. You know that we have a wonderful brand new cadaver lab downstairs where we have cadavers that are donated or otherwise to our program, so students get an opportunity to actually learn gross anatomy on a live, you know, cadaver.
Well, I think, I'll tell you one thing, you have sold this program, so I'm sure people looking at the program will say, well, just give us a telephone number so we can call her, and because we want to become a PA. Maybe you can give a telephone number, or a number that they could call, or how should they get in touch with your department?
Well, the main phone number for the program is 718-270-2325. And that's the program administrator. My number is 718-270-7645.
Right,
And people surely can give me a call, give SUNY Downstate Physician Assistant Program a call. We have regularly scheduled information sessions where people can find out, come here and find out a little bit more about the program. Of course, the www.downstate.edu, they can go to the school's website and look up the Physician Assistant Program, get plenty of information on the program here. And there's just a wealth of information about PAs altogether, all across the World Wide Web.
Oh, that's wonderful. Now, I know you don't only do that.
Yes.
You have a family and everything else, but tell me something a little bit about the programs that you're working with now with, say, Ms. Dawson.
Yes, Dr. Jacqueline Dawson. Dr. Dawson is the founder of a program called RICH, which stands for Reach Intercultural Heights. And I've had the pleasure of being able to work with her. What they do is they go into neighborhood schools and they work with young people and help them develop themselves and to develop themselves with regards to information technology and just bettering themselves as young people growing and going into society.
Right.
They are associated with various other different programs, the NVLP, which has a special site on there where they introduce young people to elders in the community, where they get an opportunity to speak and write back and forth essays about different projects, and and just it's just a wonderful thing for me to be involved when.
These are high school students?
Yeah, high school students, yeah. I always wanted to find a way to meld my communications degree with my medical degree. And I particularly have a liking for the younger people. I feel that when I speak to them that we really connect and that I'm able to get across my ideals about how nowadays young people can really start to better take care of themselves, set goals for themselves in life. Because, of course, our younger generations need a lot of guidance. They need guidance in things that they're not getting in school and sometimes not getting at home. Schools don't have the health education, sex education courses like they used to when we were in school. So sometimes I feel like these things are a little bit lacking, and I like to give back in that way. Currently, we're interested in doing some fundraising. I mean, RICH is a 501c3 not-for-profit organization that has been around for several years, and it's doing wonderful things in the community. So it's something that I'm happy to be involved with.
Well, I was glad to, I hope that I introduced you to that program.
Yes, you did.
Yeah, right. Because I think that it's from your energy level and just your intellect and how to reach young people. They're not interested in somebody coming in looking morbid or what have you. They
not
want
at all.
energy. And I know you can deal with that energy that you have to espouse to them and so forth.
Oh, yeah.
Because it takes a lot of energy when you talk to a group of young people. They're looking at you and they're almost saying, "Prove yourself."
Oh yeah. Oh yeah.
What do you think you can do with me?
Because it's funny you should mention that, because I kind of feel like I've often been told I look a little younger than I am. Most people wouldn't guess how old I am. On the other side of the coin, in the medical profession, a lot of people look at me and they say, "Who's this young person coming in here and what are you going to do for me?" And they'll say, "When's the doctor walking in?" And I have to say to them, well, I'm a certified physician assistant and I'm trained in medicine and capable of treating you, diagnosing you, giving you everything that you need and taking care of you for whatever medical ailment that you have. Once again, PAs working everywhere from psychiatry to surgery. We deliver babies, you know, and there are a lot of different areas that we work in. And you know what? It's really across the board. And I think that a greater amount of knowledge is needed by the general public about physician assistants. And this is a wonderful, I thank you once again for having me come on so that we can explain and people can see what a wonderful career choice that it is. It's growing by leaps and bounds.
Oh, I know that. But let me tell you, I think that again, with your energy and things like that, you should be talking to medical students. Because, you know, when a person looks at a doctor, they're taking a whole look at the doctor, their voice, their energy, and everything, you know. And medical students sometimes don't give that image a lot of times, because I think medical students are often chosen for marks to get in school and certain tests they take to get into becoming a doctor. But a lot of time, the personality of a doctor is so important if you really want to get a good history, if you really want the person to get well. You know, that's to get wellness. That's my point, because I think the PA with their hands-on type of thing really gets the patient well when you just touch that patient and talk to them in a certain way that they can become well.
Once again, Dr. Deas, you touch on a very important part of what the physician assistant is all about. Patient education. Small scenario. Patient comes in, sits down with me, and I ask them in the history, "Oh, what surgical history have you had?" And they said, "Oh, I had something taken out 10 years ago, and I don't know what it was for." Right? It's a shame that a lot of times, and of course this is across the board, you know, sometimes people are not as good at giving information and educating patients as they should be. But PAs are specifically taught to be educators of patients so that they can understand what's happening with them, why they're needing to take a particular type of medication, go through a particular procedure. It's not that doctors are not taught to do that or medical students are not taught to do that, but we live in a society where time is of the essence. And some people feel that the time that it takes to talk to a patient and explain these things to them takes up too much time. It really doesn't if you learn how to multitask, where you can do your interview of your patient while you're getting a little bit of the physical exam in and really be extremely thorough with the patient. Patient education, patient education, patient education is so important. And it's something that PAs really strive to be very, very good at. It's something that we're often complimented on. When patients will say, oh, the doctor doesn't spend very much time with me, I feel like I'm in and out. Not to knock physicians, because everybody has their place in this world. But PAs are particularly attuned to making sure that patients are educated about what's happening with their health care.
Well, do they have the PAs and the medical students mix while they're going to school here, mix up in certain classes or discussion groups and things like that?
Well, I wouldn't say discussion groups, but we do happen to do a lot of our clinical rotations along with the medical students. And this is an area that I think maybe needs to be worked on just a little bit more. At the earlier stage with the medical student probably would be ideal to get them to understand a little bit better exactly what that physician-PA model is. Oftentimes we'll send PA students out to work with preceptors. Those are doctors or other physician assistants who take a physician assistant student who is learning underneath of their wing to teach them about the medical model and help them along in these different specialties that we can work in. But oftentimes, sometimes the medical students or the residents don't understand exactly what the role is of the physician assistant. Not just to have them go and take the blood work and have them run around and do all the little errands, but to actually integrate them into the team. We rotate on those same medical teams that the physicians do when you come to the hospital. When you go to the hospital, when you go to a clinic, when you go to any kind of healthcare center, chances are there will be a physician assistant there doing something for you.
Well, I'll tell you, I think that Barack Obama, President Obama, should really be looking at this program and saying, you know what we need in our cabinet is a PA.
I would like to speak to President Barack Obama about ways to help him stop smoking. Which is something I know that is a goal for him.
I know, and you know, doctors spend a lot of time, doctors themselves do not spend enough time on those kind of preventive things.
Oh yes, very important.
Of smoking and drinking and things where they might just say, do you drink or alcohol or do you smoke? I for example, I was involved in patients eating laundry starch, argo laundry starch,
oh my goodness,
which caused iron deficiency anemia. But you couldn't ask a patient, do you eat starch? Because they would think of potatoes and rice and things like that. But if you didn't know the ethnicity or the cultural habits of that person, you have to say specifically, do you eat argo laundry starch?
Yes.
You know?
Very important.
And you'd be surprised how all these little fine details just make you a better physician to get to why they are anemic, for example. You know, not just we're going to do a bone marrow and do this kind of testing and things like this. We know you're anemic, but why are you anemic?
Yeah, you have to be attuned to, as I said, your catchment area or the patient base that you're working with. Let's say, for instance, at the doctor's office I worked at in primary care, there was a very high Haitian population. And as you probably well know, amongst a lot of Caribbeans, they like to use a lot of complementary alternative medications. They're into garlic. They wear these copper bracelets to help. And you have to understand, sometimes even the terminology that they use may be different from what general population would understand. Let's say, for instance, small example, I had a patient come and tell me that they had a problem with their foot. So of course I'm going in, I'm going to examine the person's foot, but it really wasn't the foot that was a problem, it was actually the lower portion of the leg. So sometimes there can be these little disparities in understanding, and we have to take time to make sure that we understand those cultural differences, what different kinds of medications and alternative medications people may be using. And of course, always remember to ask them about over-the-counters. People don't think of over-the-counter medications, things that they buy in the drugstore or get from bush doctors and various things as medications. They really are. And of course, we know, and I know you well know, that those things can also interact with the types of medications that we prescribe. And those things are important to ask about too.
Well, I tell you, Julie back period, being a physician associate,
physician assistant.
Yeah, but a physician assistant, but in this department, your title?
Senior clinical coordinator, assistant professor.
All right. I know they're going to be calling you. A lot of folks will be calling you today to talk about this kind of field, and I hope your phone will not be worn out, because I'm sure there's a lot of people out there could have new careers, you know, and things like this. So it's just a pleasure having you today, and this won't be the only time we're going to have you on the program, because we're going to bring you on to discuss certain disease states and how you approach them and things like this, to give more a broader look at the PA, you know, and what their clinical status is, and how you can supply that doctor, that patient for that doctor. By the time they reach a doctor, they almost know how to tell the doctor what they have, you know, rather than just come
sometimes they never actually see the doctor. They get complete and total care from their physician assistant. And I once again have to thank you for having me, because I think in today's discussion, we've really given the public a good idea of what a physician assistant is.
Well, we'll certainly post your numbers to be called.
Most definitely.
Thank you so much for being with us.
Okay.
Right.